Great. Why don't we get started? My name is David Jordan with the United Methodist Health Ministry Fund. I'm also a member of the Governor's Commission on Racial Equity and Justice. I want to thank everyone for joining today's webinar to review the Commission on Racial Equity and Justice's state administrative recommendations. Today's webinar is the final webinar of a 3-webinar series highlighting the Commission's recommendations. Today's webinar will highlight state administrative recommendations included in the 3 reports released by the Commission in 2020 and 2021. The previous webinar is focused on legislative and local government recommendations and can be accessed on the Health Fund's website. The Commission's report can be found on the Governor's Commission on Racial Equity and Justice's page on Governor Kelly's website. Of course, we want to thank Governor Kelly for her leadership and vision in forming this commission. First, I want to start by thanking all of the commissioners who participated in this commission. I want to thank the several commissioners who joined us today, notably our 2 co-chairs, Commissioner Dr. Shannon Portillo and Dr. Tiffany Anderson, as well as others who were able to register and join. I also want to thank Kate Davis, Governor Kelly's Director of Regulatory Affairs, who supported the commission over the last 20 months. I would also like to thank the co-sponsors of the event who helped us spread the word about the events and have participated in the robust dialogue over this series. We really appreciate your efforts. It's through your efforts, your partnership, and your work that many of the recommendations in this report can be realized. So we see this as a blueprint for many folks to take leadership on these recommendations. So we're very excited about the participation to date. Now, some quick housekeeping items before we get started. Due to the large number of folks participating in today's webinar, we ask that folks stay on mute throughout the recommendations and also use the chat function. Given that, we'd love for you to introduce yourself in the chat, as well as to ask questions or make comments throughout the presentation. We'll be referring back to the chat during throughout our presentation to look for questions, look for answers, and towards the end, if we do have the opportunity, we will unmute folks. But again, please use the chat. We'll be monitoring it. Before turning things over to Dr. Portillo to kick things off, the agenda for today's webinar is the welcome and introductions. We'll present on the commission background and report recommendations. And then if other commissioners are able to join and are interested in sharing reflections, we'll create some space for them. We have a great reactors panel featuring Dr. Deangelo Burns Wallace, who's the Secretary of Administration for the state and previously was the undergraduate provost at KU. She was also a commissioner on the Governor's Commission on Racial Equity and Justice. And Deborah Miller, who's the director of the Kansas University Public Management Center, previously serving as Secretary of the Kansas Department of Transportation and Policy Director for a past governor of Kansas. So we have 2 experienced leaders who have led state agencies who can offer great insight into the recommendations. Then we'll have some time for some discussion, question and answer. As with past webinars, we hope you'll engage and we hope you'll share thoughts in the chat. We look forward to a robust discussion today and ongoing partnership to support these important recommendations. I'll turn things over to Dr. Portillo.
Thank you, Commissioner Jordan. As Commissioner Jordan mentioned, I'll provide a bit of history and background on the commission. So the commission was formed in summer of 2020 when Governor Laura Kelly signed Executive Order 2048. She asked the commission to study issues of racial equity and justice across systems in Kansas. This commission is not just about criminal justice reform, though we know a lot of the racial unrest during the summer of 2020 caused by the murder of George Floyd and Breonna Taylor was focused around the criminal legal system. Our commission was focused on racial equity in systems across Kansas. The commission brought together 15 Kansans with perspectives from the criminal justice system, education, healthcare, advocacy, and a number of nonprofit organizations. In 2020, we focused on criminal justice, but in 2021, we shifted our focus to look at the social determinants of health, looking specifically at economics, education, and healthcare. Our 2020 report was submitted in December of 2020, and that did have a focus on the criminal legal system. The report included over 60 recommendations. We divided all of our recommendations into 3 areas. focused on state agencies and administrative actions, the legislature, and then local governments. Our goal was to ensure that we had accountability and clear direction of where these recommendations could take place. Our 2021 report had the same breakdown of recommendations to state agencies, local governments, and the legislature. But what we heard in 2020 when looking at the criminal legal system is that there were a number of overlapping and connected issues in communities across the state. So we decided to use the social determinants of health as a lens to really look across these issues and consider the interconnected ways that we could support Kansans of color. We specifically focused in on three broad areas: economic systems, education, and healthcare. And I will turn it over to Dr. Anderson to discuss our process and timeline. And Dr. Anderson, you're muted.
My apologies. As we look at the process and timeline over the last 20 months, we're going to first start talking a little bit about the Commission's work. The Commission met every other week from July 2020 through December 2021, hearing from state and national experts, local leaders, and community members about topics important to Kansans. Meetings included learning sessions, presentations, and discussions. The Commission took information from these meetings, and that's how we developed the recommendations that you're about to hear about. We talked about improving racial equity for the state agencies, for the legislature, and local governments. The Commission also solicited feedback from Kansans via social media. People could write into us, as you'll see on this next slide. They could call in, they could watch the video. Really, we gave multiple avenues for individuals to give feedback, and we got feedback from all of those avenues. As we continued the work moving forward, we developed our first report. From that feedback and all of those presentations, the Commission's first report includes over 60 recommendations for state agencies, for the legislature, and for local governments. Those recommendations focus on law enforcement training, officer certification and standards, recruitment and retention and promotion, accountability, data collection, public defense, justice system, school resource officers, tribal jurisdiction, immigration and law enforcement, behavioral health, and law enforcement funding. Now, the Commission's 2021 report, the one that you would have just read, really focuses on the social determinants of health. These included 90 recommendations, and they were really focused on three subcommittees. I was the chair of the Education Committee, Dr. Portillo was the chair of the Economic Systems, and Commissioner Jordan was the chair of the Healthcare Subcommittee. In that report, those 90 recommendations fell into the following areas: early childhood and child care, which we'll be talking a little bit about today, maximizing federal funding, tax policy, teacher diversity, post-secondary education, school resource officers, school mascots, maternal and child health, vaccine equity, universal equity policies, housing and homelessness, broadband, wages and lending practices, workforce, access to healthcare, family planning, behavioral health, ACEs, which are the adverse childhood experiences and interfamily violence, and the juvenile justice system. Dr. Portillo will talk a little bit about the 2020 recommendations.
Thank you, Dr. Anderson. As I mentioned, our 2020 recommendations really focused in on the criminal legal system. And some of the recommendations that focused on state agencies included enhancing ongoing social equity and anti-bias training curriculum. This is working with the Kansas Law Enforcement Training Center to ensure that anti-bias training is robust and included in training for all law enforcement officers across the state. And then also working with the Kansas Law Enforcement Training Center to create standards for ongoing officer training. So currently there's a standard of 40 hours of ongoing training per year. We'd like to ensure that that continue and that we also think about how we can enhance that training to consider it through a racial justice lens. We also made recommendations around public defenders' offices. We asked that the state of Kansas to require a public defender's office in any county with a population greater than 100,000. Public defenders cost less than court-appointed attorneys and are available for first appearances, providing continuity in case coverage. These were recommendations that were put in place in 2020, and since this recommendation was put in place, the Board of Indigent Defense Services has voted to bring public defenders offices to Wyandotte County and Douglas County, which would fulfill this recommendation. We're just looking at whether the legislature will fund those office expansions. And we also suggested that in coordination with Kansas tribes to update and revise the Kansas Law Enforcement Training Center curriculum related to tribes and tribal sovereignty to make sure that every law enforcement officer would have the kind of background that they need to engage with our sovereign tribal nations in the state. And I'll turn it back over to Dr. Anderson for additional recommendations from 2020.
The other recommendation was really focused on just diversity in law enforcement. We recommended that a position be created in state governments to focus on diversity in law enforcement and to assist in law enforcement efforts to increase diversity. The governor's office should consider a position for an individual focused on diversity in law enforcement who shall report annually to the governor. This individual should be an experienced diversity leader to assist and collaborate with all law enforcement agencies. This would include CPOST, KLETC, on how to establish equity, diversity, and racial inclusion amongst all levels of the agency. We felt this position would work directly with the chief of police or the head of each law enforcement agency to create strategies to implement and connect the dots between diversity and inclusion efforts across the state's enforcement agencies. Each agency shall report their diversity hiring and recruitment plan, and implementation of each plan would be reviewed and monitored on a quarterly basis by this individual. And really the focus is on accountability, making sure we have strategies in place, but that also we're holding ourselves accountable to ensure that diversity increases in law enforcement. The next recommendation that I'll speak to really addresses the state's entity to really analyze and publish just data for law enforcement. We recommended that we identify a state agency or a regent university to analyze all law enforcement data and use of force and racial bias complaint data to identify trends and make an annual report available publicly so that we all have access to this and we're working collectively in addressing this area. The other recommendation is increasing the use of mental health first aid training, crisis intervention training, and other behavioral health trainings for new and existing officers. Increasingly law enforcement officers are being asked to respond to mental health crisis situations. And we know that all officers really should be equipped to de-escalate and safely resolve emergency and mental health incidents. But the only way to do that is really to provide added mental health first aid training and crisis intervention training. I'll turn it back over to the commissioner colleagues to talk about the remaining next set of recommendations.
As we approached our 2021 recommendations, as Dr. Portillo and Dr. Anderson had mentioned, the second and third report focused on a broader social determinants of health focus. One of the major groundings to that report is understanding the need to collect data and analyze the impact that policies have on race and equity. So building off of some frameworks other states are employing, we made the recommendation that the state, all state administrative policy is viewed through a racial impact lens. So similar to doing a fiscal impact note, recommending that state agencies do a racial impact assessment and note on regulatory policy as well as legislative policy proposals. Along those lines, we also recognize how foundational language is to access to services and the role state government plays in folks' lives. So making the recommendation that we provide language interpretation and translation services so that all Kansans have access to their government. And I'll turn things back over to my colleagues.
Thank you, Commissioner Jordan. I chaired our economic subcommittee for our 2021 report, and we had quite a few recommendations that focused on how we think about funding in the state. The first is that we suggested maximizing federal funding, and as we're looking at federal funding coming through the state, particularly with the American Rescue Plan Act and funding coming out of that, consider the perspectives of people of color and people from groups disproportionately impacted by COVID-19 in the process of distributing federal relief funds. So we want to make sure that entities are specifically looking at how we can use this funding to help communities of color, which were disproportionately impacted by the pandemic. Then also ensure that there's the lowest administrative burden possible for communities and individuals accessing funding and assistance. So making sure that our application procedures are simplified and as accessible as possible, making sure that administrative burdens aren't getting in the way of individuals accessing funding or government services. We also spent some time talking about tax policies, and we suggest that the state of Kansas implement an equity assessment on tax distribution and consider how the state can collect future race and ethnicity data around tax collection and distribution. This goes to what Commissioner Jordan was mentioning earlier about data collection. We're hoping that the Kansas Department of Revenue and local taxing authorities could develop a plan to collect race and ethnicity data on tax collections and distributions so that we can analyze how Kansans of different races and ethnicities are impacted by our taxing structure and how we're using these funds. We spent quite a bit of time also discussing housing and homelessness, and so we recommended exploring options to provide access to counsel for individuals involved in eviction cases. Property taxes and utility payments can fluctuate and create significant burdens for folks, and assistance programs can help bridge the gap for homeowners experiencing temporary need. When those programs and policies don't work and homeowners or when renters are facing eviction, that's a court process where folks often don't have access to counsel. And we suggest that by providing access to counsel, we may help folks stay housed. And I'll turn it over to Dr. Anderson to discuss some of the recommendations from the Education Committee.
Thank you, Dr. Portillo. Okay, so I'm the superintendent of Topeka Public Schools, and I can tell you that teacher diversity, as we kind of share some of these recommendations, is an area that I truly believe everyone across Kansas can embrace and implement policies that can adjust what teacher diversity looks like. Often we say people don't apply, but really I believe, and we looked at systems that have shown to be effective in terms of increasing diversity. So we're recommending ensuring policies can be adapted for education students. Many of these students have outside jobs and families and limited financial resources. So we really need to adjust the system for the current student today. State and district policies should allow institutions of higher education to offer a diversity of programs for teacher preparation, offering low-cost options for teacher preparation and certification, and support statewide programs to recruit and prepare minority teachers. Training institutions should provide individualized supports for education students and adjust to their needs. See, the teacher preparing today is very different than 30 years ago, so we need to adjust the system accordingly. The next recommendation was really regarding the juvenile justice system. We believe that data tells a story of how you break the school to prison pipeline. So we're suggesting and recommending that we disaggregate statewide juvenile detention center data by race and county to further examine that pipeline and to invest supports and education efforts in schools and in neighborhoods feeding the pipeline. You know, in order to address the root cause of juveniles offending, the Kansas Department of Corrections should collect data on juveniles who are incarcerated by race and county. This will allow the state to really target those interventions in the regions that have the highest rate of juvenile incarceration. The post-secondary recommendation, I'll turn it back over to Dr. Portillo to talk a little bit about those two recommendations. What you'll find is there's tremendous overlap between these three subcommittees. So what we talked about in education would come up in the finance section and would come up in the behavioral health, which is why the social determinants of health is really the way to approach all of these issues to have a more equitable system for all Kansans.
And so I believe our next two recommendations are focused, a bit about our post-secondary recommendations and making sure that we're doing everything we can to connect students in their K through 12 journey to higher education possibilities. And so here we really wanted to focus on connecting career and technical education systems with workforce needs and developing public-private partnerships, but also ensuring that we have accessible transfer pathways from 2-year to 4-year educational institutions within the state. In my work with the KU Edwards campus, we work quite a bit with transfer students, and our transfer students are disproportionately students of color and first-generation college students. Currently, the way that Kansas Board of Regents policy reads, transfer credit coming from a community college doesn't transfer at the same rate, even if they're the same course, as transfers coming from four-year institutions. So equalizing this transfer makes four-year educations more accessible to communities of color and first-generation college students. So we need to work with the Kansas Board of Regents and state agencies where we can to make sure that transfer is as accessible as possible. And I'll turn it back over to Commissioner Jordan to discuss some of our health recommendations coming out of 2021.
Thank you, Dr. Portillo. The healthcare group, as highlighted earlier, covered a number of topics. As we looked at maternal and child health, we really put an emphasis on how can we make policy recommendations as upstream as possible so that we could have the longest impact on life. So really focusing on the prenatal to 5 space by looking at maternal and child health. In that recommendation, we recommended developing payment policies to reimburse community-based providers, such as community health workers, home visitors, doulas, and lactation consultants. This really, I think, spans a couple of topic areas, both developing a payment system so that there can be funding for services, developing a culturally competent care team that would have reimbursement for services, and funding these services that are community-based in nature and preventive in nature. So developing programs and payment policies that prioritize infant and early childhood mental health and healthcare by paying evidence-based dyadic care models, family therapy, parenting programs, and also exploring how team-based primary care, high-performing medical homes, and comprehensive home visiting programs can support 2 generations of care. So there's a lot included in this recommendation, but it really is investing in the earliest days of lives and supporting both culturally competent care and ways to support holistic care. Also, we'd be remiss as a committee if we didn't recognize the importance of vaccine equity as a state administrative recommendation. We recognize the need to utilize culturally competent messaging about vaccine efficacy and availability, making sure materials and communications are available in a variety of languages. Urging that all communications from state and local government about vaccines, vaccine availability should be clear, timely, and culturally competent. In relation to the COVID-19 vaccine, messages should also highlight that vaccines are safe, effective, and free, and that individuals who refuse to share personal data will not be turned away from getting a vaccine. We also recommended using a variety of media channels, including social media, ethnic media, traditional media, and mainstream media. And also employing outreach like phone banking and door-to-door outreach to help improve access and awareness of services to hard to reach vulnerable populations and communities of color. I think one other thing to highlight is that we took a universal approach to vaccine equity. We know that vaccines requirements or wellness vaccines are required for entry to school, but they also have broad support. A recent poll showed 95% of Kansans support wellness vaccines. And I think it's critical that we continue to communicate about all vaccines in a culturally competent manner and make sure we're reaching the most vulnerable populations.
As we conclude our report, I'm sorry, go right on ahead, Commissioner Jordan.
Sorry, Dr. Anderson. From a behavioral health standpoint, similar to some of the recommendations on data recommended by the economic work group, we recognize the need to track data and coordinate services between systems within behavioral health. So we made the recommendation of supporting better collaboration between the behavioral health system, the legal system, law enforcement around behavioral health. So how can we integrate trainings, data tracking by race and ethnicity, and making sure that not just maintaining this race and ethnicity data on behavioral health incidents involving parents and young children and law enforcement, but that we're sharing it between agencies. We know that this data is really important and it needs to be available and disaggregated. Again, taking the approach of investing early and aiming to have the most impact, we made some recommendations around adverse childhood experiences and interfamily violence. So again, improving coordination and partnerships to increase access to preventive services and guard against the impact of adverse childhood experiences. there's a number of things that the state can do to promote and fund partnerships between the early childhood sector, behavioral health professionals, the private sector, and law enforcement that can improve access to services, and the use of preventive services to reduce interaction with the justice system, the child welfare system. These things save money, but also make sure we're providing families, and most notably children, with the resilience to manage toxic stress levels, which will have a lasting positive impact on childhood development and outcomes later in life. These recommendations really span, including payment policies for funding care coordination services, funding pediatric care coordinators, funding community health workers, and other culturally competent professionals that can coordinate services for young children and their caretakers to have a lasting impact throughout life. Along this line, also in the early childhood space, we recommended implementing a DC 0 through 5 crosswalk. The DC 0 through 5 crosswalk is a way to help change how diagnosis and classification of behavioral health issues are made, so that we're not tagging young children with problematic diagnosis early in life that may have an impact in how they're interacting both with the health system or possibly law enforcement. DC 0 through 5 is a manual for diagnostic classification for mental health and developmental disorders for children 0 through 5. Adopting this set of classification enhances mental health professionals' ability to accurately diagnose and treat mental health disorders in the earliest year, while also capable of being able to be crosswalked to ICD-10 codes. DC 0 through 5 provides a developmentally appropriate diagnostic assessment, allowing for the identification of medically necessary early childhood mental health conditions, and facilitates Medicaid reimbursement for the appropriate treatments. DC 0 through 5 has been adopted by in Medicaid policy in at least 10 states and is considered a best practice. One other recommendation, sort of that echoes a recommendation made by the Economics Committee that I just wanted to highlight that we didn't put on a slide, was just how can we, as a state government, particularly Medicaid, reduce administrative burdens for enrollment in Medicaid and other safety net services. And I think that's really something that should underscore all recommendations, as well as how do we use existing programs like Medicaid re-procurement in the upcoming years just to make some of these changes and recommendations possible. How can we look at using Medicaid as a payer to support things like housing and social determinants of health services? So it was really exciting to have these forward-thinking conversations across the committees that were all interconnected. One other thing just to highlight quickly, earlier this week on Tuesday, the Kansas Reflector published the first op-ed in a series of monthly op-eds that are based off of recommendations made in this report. The first op-ed in the series focused on how Kansas can address racial equity in the criminal justice system, and really drew heavily on the first report. We'll have 11 additional op-eds, one a month over the coming year, that will touch on a number of issues, all grounded in recommendations in the report, spanning legislative, state administrative, and local government recommendation. The next op-ed in the series later in March will focus on maximizing federal funding and tax policy. And I'll turn things back over to Dr. Anderson.
Thank you, Dr. Jordan, or Commissioner Jordan. I know it feels like we've gotten a doctorate after doing all of these sessions and all the learning that we've done. Those commission reports, we just want to let you know, are online if you'd like to look at them directly. Additionally, the recordings are also online. If you want to just hear some of the conversation from Kansas across the state on either the first or second report, those are also online. The meetings, the learning sessions, and the documents that we use to develop the recommendations can give you some additional learning. That concludes our presentation. We'll turn it back over to Commissioner Jordan to start the reactor panel.
Excellent. Thank you so much, Dr. Anderson. I'd like to remind folks to use the chat function to ask questions, to make comments, and hopefully to start a discussion. But before we turn over to the chat and questions, as I mentioned earlier, we have two wonderful reactors that have a significant amount of experience working within state government and without state government, bringing great perspective to this. First, I'll turn things over to Dr. Deangelo Wallace, who's the Secretary of Administration and who is a colleague and member of this commission. Dr. Deangelo Wallace, I'll turn things over to you.
Good afternoon, everyone. Thank you so much for allowing me to join this conversation. As my colleagues on the commission have shared, this was such a dynamic experience, and the opportunity to take the time to really think through these issues critically, to be able to pull information, to have listening sessions, and to hear from those throughout the community that are impacted and that are doing the work really shape the recommendations. And so I hope that you hear that in what you saw today. As a state agency leader, and I was asked to kind of reflect from that state agency seat and thinking about how do we bring racial equity into consideration as we think about these recommendations or others that may not be specific to our agencies, but have the potential to have a similar impact. There are a couple of things that just came through from the work that we did, and I believe you can hear it in the recommendations. I think first and foremost, it's around using the equity lens in decision-making and making sure that there's both an internal and an external look. So as agencies, as entities that are influencing policies, structures, regulations, licensing, to be able to look both internally at our policies, our structures, our procedures, but also externally to who we are serving and how disproportionate communities are being impacted as this work is happening. I think one of the other things that we noted along the way, and you heard it a little while ago, I think a few times, is both data and training are critical. And they go hand in hand in terms of kind of looking at ensuring that an equity lens is sort of part of our decision making. Because for the data, we need to understand where we are and what we're doing and be able to track on the impact that we're having. But instead of just jumping in and saying we're going to do X, Y, and Z, that data also drives where we need to go and where the work needs to happen, particularly from an equity lens. I also think that the idea of truly like being intentional, not just saying that some of this needs to happen, but as you can see from some of the recommendations, being very specific, right? And making sure that these things are intentional and institutionalized. So they're not depending on an individual, but they're now part of our standard operating procedures, our structures, our key performance indicators, our KPIs, but that it is a part of the work that is being done and not left to an individual that might be passionate about equity and coming to the table and ensuring this work is being done, but it is ingrained in the way that the work is being done, that the work is monitored, the outcomes that are reported. And then lastly, I would say, or two more things. One is the idea around the expertise in this space. If we did nothing else, we showed the depth and breadth of expertise that we have across our state doing this work. And it is key and critical as we inform this work that we are bringing that expertise to the table. I see a colleague of mine, Dr. Jimena Garcia, who is on today. Dr. Garcia, if you don't know, was named early last year as the governor's advisor on COVID-19 vaccination equity. And she led a different group around and continues to lead the efforts to ensure that the work that is happening in that space brings an equity lens. She brings a level of expertise and knowledge coupled with the others that were brought together in her group to inform the policies that the state was putting in place, giving advice both to state agencies, local agencies and entities, looking at federal, looking at best practices and bringing them all to the table to make recommendations to ensure that that equity lens is the part of our decision making. We have to leverage the expertise that we have in our community. The last thing that I would say is that access and leveling access is so critical. You heard a number of recommendations that talked about making our processes easier, making it so that those who need to get to the resources can find them, can get them, can utilize them. as state agencies, we control a lot of our processes. And I will be honest, a lot of the work that I've done over these last few years has been taking parts of my organizations and parts of state agencies and being reflective on, is this the easiest process for us as the agency, or is this the process that's needed for those that we are serving? And we have to be looking outward and saying, it may be easy for us to process this way, but what do we need to be presenting so that those that need the resources can actually access the services that we're trying to deliver? So I hope that there's a number of takeaways that you receive from the report, and that you see, even if we didn't hit your specific agency or sector, that you can see parallels that can be pulled through as we think about how do we bring this equity lens into state agency, local agency decision-making. So thank you.
Thank you, Dr. Burns-Wallace, for that very important perspective. I'll turn things over to Deb Miller to share her reactions, and then hopefully we'll get some questions in the chat and look forward to continuing this robust discussion. Deb?
Thank you, David. Thank you for asking me to participate today, and it's a pleasure to be with all of you. This is really such important work, and I think you can tell just from the presentation that we saw today, but certainly if you haven't yet looked at the report, if you pull out the report, something that becomes apparent immediately is just the depth and the breadth and the comprehensiveness of these recommendations. And, you know, I can't help but reflect on the fact that the depth of these recommendations also is an indication in many ways of just how pervasive and deep-seated these issues / problems are, not just in our own state, but, you know, broadly across society. And in order to really address it, it clearly does take that systems thinking. And so I really congratulate the commission on having that notion of bringing in the social determinants of health and really thinking about how all of these things integrate together. And I love the point that was made today about looking at where we can start at some of the youngest ages and start making improvements so that we have this very long lead and approach to what we're doing. Secretary Burns-Wallace mentioned this, but I want to say that one of the other things I was struck by is how frequently there was a recommendation to either take data that we are collecting and make it more accessible, or to collect data we're not currently collecting. And while it may sound like it's not much, I have been struck throughout my career how much difference it makes when you take data, you make it visible, and you use it, and you expose issues through the data that people need to understand better and react to. There's a neutrality in some ways to data that I think really can carry the day. And so I am very impressed and pleased to see so many recommendations that talk about some of those data issues. And I do think as we look at such a comprehensive report, and, you know, quite frankly, just know the difficulties. You know, I appreciate the work that Secretary Burns-Wallace has done and the perspective she has brought to her agency and to state government. But it would be less than honest to say not everyone brings that. We don't always have it, and we won't always have it. And so trying to create a structure or a culture where it's expected, it's required, I think that's on all of us. And so, you know, we can't just think, oh, here's the recommendations for government agencies and we pass them off. We're going to have to be a part of what holds all of this work accountable. And finally, one of the points that I would like to put on the table is that concept of accountability. It is never enough to just prepare a report. If there isn't some ongoing focus or perspective in terms of making sure we're making progress, it's very easy to fall back and to forget about the things that we need to do. And so I've been thinking a bit about this, whether or not it's likely that government would pick up the responsibility for being the accountability monitor. I don't know, but I do think it would be possible to create some sort of accountability structure outside of government. And I think it's very important to do that. It might even improve the fact that if you had this evaluative process, if it was done at arm's length, then maybe it would be better if it was done outside of government. And I know there are a number of people from the foundations on this webinar. So I put that out there for your consideration. I certainly think it's something that could be given consideration by the foundations in Kansas. And if we had the opportunity through a very clear set of accountabilities to monitor and track what we're doing and where we're making progress, and then modifying where we need to modify based on that data and what it tells us about progress, I think we can move forward. But I want to come back and just say again, there's something very uplifting about both the report, the people who came together to do it, and then the participation on these webinars and the level of interest and intent that I think you can see from people across broad specters of Kansas government, public sector, policing, education, and it gives me great hope for the future.
Excellent. Thank you, Deb. And thank you again, Dr. Burns-Wallace. One of the comments in the chat box was made by Tanya Dorf-Bruner, just recognizing that the Oral Health Kansas is pushing the state dental board for better data in terms of licensing. And I think that speaks to both that accountability piece that Deb mentioned, that we all have some role in accountability because not everyone's tracking dental licensing data, but also the state is being responsive. So I think it really speaks to the leadership that we can all take as organizations, philanthropy, nonprofits, government. So I think that's a real positive. Other questions for any of the commissioners or the reactors in terms of recommendations or the very thoughtful and inspiring remarks made so far?
Commissioner Jordan, if I may ask, and on the heels of Executive Director Bruner's comment on the dental board piece, I'm sure there are probably a variety of systems that are either underway now or are about to be underway that really address social determinants of health. This is really a great platform to share some of those things that are currently either underway or that you're thinking about. As one example, Dr. Garcia, as she began her role, one of the items that's been just a wonderful platform for us was to advocate for health clinics, which is in our report, to be inside of schools. And so Topeka High has one of the few, it's a University of Kansas health system in Topeka High. So the pediatrician, all of that, those services are there. But when we went into the pandemic, it allowed for us to then have on-site vaccination clinics. We've now had 15. Our next one is coming up in a couple of weeks. But while we had those vaccination clinics, we were able to give out groceries, school supplies, do the health checkups. See, here's the thing, programs come and go. And I continue to say that with the leader and with the money, systems remain. So we've now created a systematic way of whenever there's a health crisis to be able to provide the health service in the middle of a school and then do all the other things, physicals, dental care, whatever else they need from the school. That's just one example. We'll put in the link, just an article on the last vaccination clinic. That's one example, and that happens to be the one that one of the ones that Dr. Garcia came to. But that's just one example. I'd love to hear other examples. And Executive Director Bruner, if you're still on, can you speak to a little bit? I know you just put 2 sentences in there, and it gives us a snapshot about how you're changing the workforce potentially through your data-driven approach.
Certainly, Dr. Anderson, thanks so much for asking. And I apologize, I happen to be on the one computer I have that doesn't have a camera, so I apologize for that. As I said, we're starting the process of trying to advocate to be able to collect data about the race and ethnicity of the dental workforce in Kansas, meaning hygienists and dentists. We know there's lots of studies out there that show that the dental providers of color disproportionately serve communities of color, but we don't have a sense of whether communities of color are getting adequate access to care in Kansas and whether the workforce adequately reflects what Kansans look like and in the communities that they live and work in. So we're excited about this. I feel like the emphasis this commission is putting on data is important. And I just, I guess maybe to even go back to a little bit of what Secretary Miller said, the data, it sounds a little bit pedestrian to talk about how important data is, but it's critical. It's kind of a boring advocacy thing to even work on in the sense of some other things we could all be working on. But data drives decisions. And I love how you just said, Dr. Anderson, that it drives systems change so that the systems are there even if the programs come and go. So I appreciate you asking some more questions. Thank you.
Any other comments folks have in terms of how they're thinking about data or really incorporating a socially determined set of health and racial equity lens into their work? Ed, I saw you just raise your hand, and I know that you're doing a tremendous amount of work now in the civic space. So I think that'd be great to highlight.
Well, Commissioner Jordan, thank you, and thank the entire commission. Phenomenal work, and I'm just so impressed with all the work you all have done to date. The question I have, I want to think about how to best be helpful. And one of the things that would be helpful for me to hear from maybe one or a few of the commissioners is, what are you most worried about right now with these recommendations out there? Powerful recommendations. What concerns you the most? And just hearing, and I'm sorry to ask a negative question. I'm very hopeful right now, but I also want to imagine how to align anything I might be able to help align around what you're worried about or what you're concerned about. So I promise to say something or to think happy thoughts at the end, but I'm really curious to hear what the concerns are, if anybody would be willing to share. And incredible work, by the way. Thank you. Phenomenal work for our state and our communities. I'll pause, see if there's a reflection.
Well, thank you for that question. This is Co-Chair Shannon Portillo. I think from the very beginning of our commission, way back in June of 2020, my biggest concern was that we're not the first commission to try to tackle issues of racial injustice. There have been a number of commissions that have come before us, and one of our first charges that we took up as a commission was to look at past reports of other commissions and see what other recommendations have been out there. And there were really great recommendations, but the biggest issue for us is accountability and implementation. How do we make sure that the recommendations that we're putting forward don't just go into a report that's put on a shelf that's never looked at again? And so we tried to put a few pieces in place. The first is what I mentioned, that we gave specific recommendations to state agencies, to the legislature, to local governments. So these weren't just kind of recommendations without implementers. We said, here's exactly who we're asking to do this work in each of these cases. The piece that I think is our biggest challenge now is that our commission has officially ended. The executive order put us in place for 18 months. Our 18 months are done, but our work isn't done. Now we need to make sure that we can implement and advocate for these recommendations. And that's something where some of us are doing this as part of our work. Some of us are doing this as passion projects, and it's going to take the entire state to really say, we need this work to move forward. So I think the biggest challenge in front of us is continued advocacy, and then what do we do with it moving forward? And all of the conversations about data like warm my academic heart in such an intense way, but data are only as good as the analysis that we put behind them. And so we need to make sure that we're collecting good data, but that we're also then analyzing it and giving it back to the community and saying, this is what things look like in our state. What's our next step? And so that ongoing and iterative process is where we're at.
Add to that, and this is Dr. Anderson, the co-chair. There's a text that says, good leaders ask good questions, and I say great leaders then get prepared to, give answers and address it. So, as we have this data and we analyze this data, then it's a matter of holding ourselves accountable to use it. I'm going to just give some real practical examples in terms of what this could look like. Both Dr. Garcia and I are both on the Topeka Community Foundation board, and they chose to adopt social determinants of health and impact investing. They are literally changing how they're investing based on adopting a model that's very different, really focused on social determinants of health, which means they're funding projects very differently, aligned to the report that we've just provided. I mean, that's one way that foundations can, really wrap their arms around. The Kansas Health Foundation as well, they came to Topeka and they just really explored redlining. Just looking at the report, looking at redlining, and looking at communities from Topeka, like a Tennessee town that 100 years ago in the 1920s was all Black, all poverty, and it's still 100 years later, all Black, all poverty. So what's that about? And what are the systems that they can't use, and how do we make it more accessible? That's just some examples. Wyandotte has a program in place, really a system to reduce homelessness, and they reduced homelessness by 40–50%. Topeka replicated it about 2.5 years ago. Poverty in Topeka is the lowest in the state. I think the second lowest in the state. That all happened in the last 3 years since we replicated the system that Wyandotte already has. It's called Impact Avenues in Topeka. And so we have impact days, and 180 or something families have been placed out of homelessness into homes and have stayed out of homelessness. So it's possible to break the cycle of generational poverty, of racial and equity issues. It's possible, but it takes a collective group of people committed to really looking at this report saying, here's my chunk. Here's what I know my agency can do to walk alongside and to keep this a living piece. And some of you may say, maybe my chunk is advocating to the legislature and testifying at hearings. Maybe my chunk is how I spend money. But I think that we all have a part to play. And if we are committed in some small or large way to keep this conversation alive. So it's not another report. Like Dr. Portillo said, our very first meeting was, hey, what were the past reports? That was the very first meeting to hear all these other commission reports. So I think all of us being advocating in a way beyond today and into the years and decades to come will make all the difference.
Just quickly building on that and then going to a question from the chat is, I agree with everything that Dr. Anderson and Dr. Portillo said. And I think we should recognize that some of the impacts of this report have been positive so far. We've seen some movement on some legislation on the criminal justice front. I was really heartened, and I'm sure it has to do with Dr. Burns-Wallace's and the governor's leadership, that the Spark Committee, when having conversations about the disbursement of federal dollars, was analyzing whether or not report recommendations made by the Commission on Racial Equity and Justice were reflected in the proposals to the Spark Committee. So I thought that was a positive. But I do think that there's more work to be done, which is why I was positive that Dr. Portillo and Dr. Anderson really set out to frame these recommendations in terms of state administrative, local government, and legislative recommendations. I was excited to see we had, the attendance for all 3 sessions, but we do have to challenge folks to get involved with some of these state administrative policy decisions that we often leave to others to make because they're not as sexy as getting involved in legislative campaigns or local government campaign policy. So I think that's a challenge we have to all of you. To help join us in seeing through both funding from the philanthropic standpoint or government standpoint, and then from the advocacy standpoint, doing state administrative advocacy and local advocacy, because those decisions matter. Convening in those spaces matter, and your leadership in those spaces matter. So I think that that's the challenge to us versus looking at it as a deficit. I think that's the opportunity space to look at. There was a question about data collection again, in terms of working with health systems, particularly around Black maternal health. And there is a Black maternal mortality crisis that exists within Kansas and other states, and encouraging data collection. And I think that's critical and certainly underlies the recommendations. And then there was a question about whether or not the commission declared racism as a public health issue. And honestly, I'm fully there with that statement. I don't know that we officially made that explicit, recognize that as explicitly in the report as in that comment section, though I'd open it up to the other commissioners to offer their thoughts and reflections on that.
This is Co-Chair Shannon Portillo. I think that part of that question is there a significance in declaring racism a public health crisis? And I would say that there is a significance because it draws attention to how racism is so intertwined with health and with the social determinants of health. And so as Commissioner Jordan mentioned, I don't know that we did enough to really explicitly call that out and make a call for declaring racism a public health issue within our report. But I think that it's something that was woven throughout the sentiments of our conversations and really clear in some of those recommendations that we do see racial discrimination and racism as interwoven in a lot of the social determinants of health. And so there is a significance to making that declaration explicit and being clear that we need to have conversations about race in order to really address racial discrimination within our systems.
Yeah. I would also just kind of echo that in that the very first report. Now, remember that in 2020, when the governor put the commission in place, it started with addressing the criminal justice system, and she was very specific about race and racism, and the Commission for Racial Equity and Justice. The very name to me is a declaration that there's an issue with racial equity and justice. So by her courageous step in saying this is the focus, because she could have certainly said it's about equity and justice and not added the word race in there, but her intentionality declares it as a public health issue. And then from that criminal justice work in 2020 and 2021, the fact that we said social determinants of health is how this work will continue shows, in fact, that it's all connected. When we talk about Black maternal health in the report, you'll see that really stand out, whether it's education, whether it's school to prison pipeline, you will see that race matters in all of these areas, and it's intertwined in such a way that you really cannot divide one from the other. In fact, the data requests and recommendations are so that we further see the significance behind poverty and race and how all of these things continue to impact us systematically. But again, the system can be broken, and we've added in the report examples of how that occurs. There's a link to one of the magazines that we just put online in terms of just articles. Sometimes we don't always look at the islands of excellence like Wyandotte with the homeless work that they're doing, and other systems, as Dr. Portillo started off talking about what the work she's involved in. Those are examples of ways that we break the system. So I would encourage you, tell your story and the story of others, and prayerfully that's continued to be replicated moving forward as we all advocate.
Excellent. Thank you, Dr. Anderson. Dr. Burns-Wallace, did you have anything that you wanted to add?
No, I would just say I would echo everything that the other commissioners have said. At the heart of this work, and I think Dr. Anderson pointed out, the governor was intentional. And if we remember where we were in the summer of 2020, when this commission was stood up, it was after George Floyd. It was after Breonna Taylor. It was after, across our country, people were asking, what is going on and what does this look like? And the idea and where this commission started, while this had, across the board had been priority in many different ways, it was the intentionality to stop and have the conversation about the impacts of race in our community and what that looked like and where we needed to go. So I do hope that people will pick up the reports. They are lengthy, but they are powerful. And to Ed's kind of question earlier, I truly hope that we will see each and every one of us our part in how we continue to make this continue to move forward, because my biggest fear is that it does sit on a shelf, and it is up to us to ensure that it doesn't, and that it does have the momentum and accountability to actually impact Kansas.
Thank you, Dr. Burns-Wallace. And I think that's a challenge to all of us to make sure this report does not sit on shelves, to make sure that these recommendations don't go unfulfilled. So I think that's on all of us. And I saw in the comments that Ed O'Malley had offered, which I think was didn't need to be challenged, to offer to do the part of the Kansas Leadership Center, which they do so many times, which is to share lessons learned and to help build leadership around adaptive and retractable challenges like this. So I know that we'll be following up with you, Ed. So I think that's exciting. Any final comments from Dr. Anderson, Dr. Portillo, or anyone else?
I just want to say thank you again to United Health Ministries for organizing this. Thank you, David, for organizing us and making sure that we're continuing to get the word out. And I do appreciate all of the time that folks have spent with us on these webinars, and hope that we can continue these conversations and continue to advocate for this change.
Yeah, and to just add to that, and I know Kate Davis is on here as well. She's played such a tremendous role in organizing every one of the listening sessions and learning sessions, and even now presenting in areas around the state. So we so appreciate Ms. Davis with the background work, in addition to Commissioner Jordan and team for these webinar series. And most importantly, all of us that are on the screen and those that aren't on the screen, we thank you in advance for the advocacy that we know you're going to do as a result of the report. It's been tremendous being able to work towards this work in transforming public health.
Thank you, Dr. Anderson and Dr. Portillo and Dr. Burns-Wallace and Deb for joining us, and to Ms. Davis and to our team who helped put these on. So it's been a great pleasure, and we appreciate everyone joining us and everyone for joining us in this fight to work to advance the recommendations in this report. So as mentioned earlier, you'll be able to find this webinar with the others on the Health Fund's website, the reports on the Governor's Commission page, and we will be doing monthly columns to keep these issues in front of you. So thank you all for your time, and we'll look forward to being in touch soon. Have a great day.